Hi everyone, this video is created by us under the Faculty of Administrative Science and Policy Studies for our lecturer Dr. Ju Sun Yo. Before that, let's enjoy our introduction video. Hi, Assalamualaikum. Today I will represent about how Ministry of Health managed COVID-19 pandemic in Malaysia. In 2020, Malaysia is not exception when it comes to handling COVID-19 issues. In 21st January 2020, passengers from China to Johor via Singapore were found to be the first instance in Malaysia. But the Ministry has handled it coolly and collectively. Malaysia economy is in decline at the same time as everyone is forced to work from home, is warned not to interact with outsiders since contact will spread the disease. What action has been taken by Ministry of Health in handling the issue of managing COVID-19 in Malaysia?
Planning is the fundamental management function which involves deciding beforehand what is to be done, how it is to be done, and who is going to do it. It is an intellectual process which lays down an organization's objectives and develops courses of action. There are three types of planning. The first one is operational planning, the second one is tactical planning, and the last one is strategical planning. The Ministry of Health uses both short and long-term planning in combating the COVID-19. For the short-term planning, the Ministry of Health has implemented several key measures such as the implementation of thermal scanning at major entry and exit points which will help identify any infected person. They also established a movement control program to restrict mobility within any identified high-risk zone, as well as the funding of a COVID-19 fund to support patients who have been affected. Moreover, MAPS has been transformed into a temporary hospital that embraces all the appropriate amenities that patients should utilize. Disinfecting activities in highly affected areas are also in process, and there is also a call to each participant who attended the public gathering forward for a test or screening to curb the virus. In its long-term planning, the Ministry of Health is undertaking several critical initiatives like increasing the bed capacity or space for a hospital that can handle the growing population of patients, partnering with Tenaga Nasional Berhad in seeking funds for financial aid, and converting public hall and indoor sports facilities into other health facilities. In addition, the MOH has mobilized former nurses to resume working as volunteers alongside other working healthcare professionals, thus providing adequate human resource to contain the calamity. In addition, members of the MOH ensure that the public is well informed on COVID-19 by passing on right information in fair amounts and through appropriate channels such as the MOH webpage, social media accounts, and others.
Okay, for organizing can be defined as a process that initiates the implementation of plans by clarifying jobs, working relationship, and effectively deploying resources for the attainment of identified and desired result, which is goals. Organizing involves bringing together individuals and resources to collaborate toward achieving the organization's objective in an effective manner. There are three importance of organizing. The first one is enhances organizational efficiency. The second one is improve coordination, and lastly, establish a foundation for success. For organizing strategy done for managing the problem, Ministry of Health of Malaysia using several steps. The first one is standard operating procedure, which is SOP, by wearing face mask. Worker and individual are required to wear a face mask while in a health facility. In addition, individuals at high risk such as elderly, individuals with chronic diseases, individuals with low immunity or pregnant mother, especially when they are in crowded places and where ventilation is poor, individuals with respiratory symptoms to avoid infection to other people. The second one is vaccination program. The development of vaccine for COVID-19 has been a powerful demonstration of how substantial public funding, intense focus, and unprecedented level of scientific collaboration can help spur innovation to address global public needs in a very short time. Lastly, public communication strategy. Ministry of Health of Malaysia managed the COVID-19 pandemic through establishment of clear communication channel, which is using social media platforms such as Instagram, Facebook, and so on. Establishment of clear communication channel by using official website, which is using the MOH official website and the MySejahtera apps to provide up-to-date information. Also, easy to detect COVID-19 infection in the near area. Okay, that's all.
So now I will present about the definition of decision making. Decision making is the process of making choices by identifying a decision, gathering information, and assessing alternative resolution. A public manager evaluates the alternative and creates a summary from the list of alternatives as a part of decision making process. Effective decision making involves critical thinking, problem solving skills, and often collaboration with others to achieve the best possible outcome. So next, I will present about decision making strategy done by the Ministry of Health, or people call as MOH. First, implement the Movement Control Order (MCO). The MCO helped to reduce the spread of COVID-19 by limiting movement gathering, which was crucial in preventing the healthcare system from being overwhelmed. Second strategy is vaccination program. The vaccination program helped alleviate the burden on healthcare facilities by reducing the number of severe cases requiring hospitalization and intensive care, allowing the healthcare system to function more efficiently. Other than that, the vaccination drive increased public awareness about health and preventive measures. More people become conscious of the importance of vaccines and general public health practice. Lastly, achieving high vaccination rate contribute to herd immunity, reducing the virus ability to spread and protecting vulnerable population who cannot be vaccinated. That's all from me.
The large part in managing the issue is controlling. Controlling in management refers to the process of monitoring, evaluating, and regulating organizational activity to ensure that they align with the established goals and objectives. The importance of controlling. Controlling is essential for the smooth operation of an organization. Control ensures that the tasks are performed correctly and help achieve corporate goals. It is particularly important for addressing specific issues and meeting organizational objectives. The controlling strategy that has been implemented by the Ministry of Health to overcome the COVID-19 outbreak. The first strategy is Ministry of Health mobilize public health workers to track close contact and ensure the accuracy of data on COVID-19 cases. The second one is Health Ministry and the government collaborate to implement a Movement Control Order (MCO) for the public. The second one is the action that taken by Ministry of Health is upgrading the health system and providing vaccine to fight COVID-19. And the last one is the Ministry of Health has worked hard to transparent during the pandemic by providing clear and up-to-date information to the public through 3 main platforms. The last part of controlling is feedback. Feedback is focusing on discovering undesirable output and implementing corrective action to measure the result after controlling. For example, MySejahtera apps. One way to improve feedback is by constantly notifying people about possible COVID-19 risk. The apps could alert users if they are entering a red zone or COVID-19 hotspot by helping them stay aware and avoid the virus.
In conclusion, the Malaysia of Health's multifaceted response characterizes by early intervention, robust testing and tracing, healthcare system enhancements, comprehensive vaccination, Efforts, clear public communication and strategic collaboration was instrumental in managing the COVID-19 pandemic in Malaysia. This approach not only mitigated the immediate health impacts but also laid the groundwork for the country's recovery and resilience against future health crises.